point, he even admitted later, he told people shouldn't be walking around with masks on, and later he said that was because we were trying to control.
Good evening, YouTube. It is Saturday night. It's kind of late here on the East Coast. I was having a lot of fun with my family earlier tonight, but I wanted to finish that stream that we started on Thursday night talking about whistleblowers and the COVID cover-up. So we have about 20 minutes left on that stream, and then I have another stream lined up for all of you that want to stay a little bit longer tonight. Again, it's related to COVID, so I want to keep the momentum going on that. I don't know about you guys, but like, I knew during the COVID lockdowns that things seemed fishy, and, you know, I tried to use my intuition and common sense and, you know, didn't do anything that I didn't feel comfortable doing. But it's just kind of strange to get the confirmation now in these hearings that there were all these like massive cover-ups going on, and, you know, our lives were in danger, and our government not only lied about it, but then silenced anybody that tried to speak up and tell the truth. And thank God for the Trump administration, because now these things are being exposed. And I think that it's important that we listen and we know. And, you know, none of the mainstream media is mentioning anything about these hearings whatsoever. And I think that's a problem, but it's not something that surprises me. And I know it's not something that surprises any of you guys watching, but let's finish up this hearing and see how it goes.
Well, the supply for healthcare professionals, it wasn't based on any science, but then later he told everyone to wear masks repeatedly. The 6-foot rule seemed to have been just crafted out of thin air with no basis in science whatsoever. In fact, he said that rule sort of just appeared when he testified, and that guidance on the shutdown of schools and small businesses was arbitrary and not based on any science. So I just want to make sure the American people hear that. You had a government who's supposed to be limited and stay out of people's lives, coming in and offering guidance. Many times it was done under mandates to close businesses, people's livelihoods, to keep children from being educated, to keep people from expressing their faith and gathering to show freedom of religion and their faith and expression. I mean, unbelievable what happened during the COVID years. I was so proud of my state, along with Governor DeSantis. We launched a grand jury investigation because the federal government sure wasn't doing it. And we got to the bottom of some of this, what was being said publicly by those that we had trusted in these positions, and how that was not actually the truth. And the science, that was where the name, the Free State of Florida, has come from. And I'm so glad now to be here as one of the newest United States senators, bringing that experience, that grand jury investigation, everything that we did differently in Florida and stood up to the madness. Because
yeah, so remember when they were like arresting people for going to church? like pastors and priests were like getting arrested for holding services. Do you guys remember that? Like, it's easy to forget. I think a lot of us want to forget that COVID lockdowns happen, but we should not forget. And it's just like unbelievable that this is what was happening, that people were getting arrested for practicing their faith. It's like a big deal here in America. Like, freedom of religion, that's like the foundation of America, right? That's what we were taught in school. We're about to celebrate 250 years of America being a country. And the story that I was told when I was a kid is we came here from England because we wanted to practice the religion that we saw fit. We didn't want to keep giving our hard-earned money to a king that, mandated we do all this stuff. We wanted freedom, and freedom of religion was a very big deal, 250 years ago. And it's just so weird that people of faith were not allowed to gather and practice their religion during the COVID lockdowns. They were villainized. They were arrested. Their lives were ruined. But you had people over here working for the government just flat out lying to us, making up all of these arbitrary rules with no science behind it, and yelling at us and shaming us and telling us to trust the science. Like, what kind of a messed up country were we living in? And how are they going to make up for these things? Because nobody's talking about that. Nobody's talking about what our government is going to do now to make up for all the stuff that they messed up on in 2020. I don't know what the answer is, and I don't know if we'll ever see an apology, retribution. I don't know. Let's continue.
That is how the people remain in charge of their government. In the grand jury investigation that we did, we followed the evidence. We found that many of those policies, including masking, lockdown mandates, they lack sufficient scientific basis, and they in fact caused significant harm to Floridians. The same grand jury found a pattern. I'm quoting the grand jury here. This is a nonpartisan group acquired from the community to judge facts, a pattern of deceptive and obfuscatory behavior from both Big Pharma and the federal agencies charged with regulating them with respect to the COVID vaccines. So it appears from everything that we found from our own investigation, an unbiased, totally separate review of what was being said publicly by the federal government compared to what was actually based in science. It found that most of what was said and the events surrounding it was a public health establishment that was fixated on controlling the public and forcing narratives rather than protecting public health or discovering the truth. And so I am grateful that you were willing to be here today. I know that this is under subpoena, but certainly it takes courage and to be here and to be a whistleblower that can get accountability for the American people. Florida was years ahead of the federal government's supposed experts. We're proud of that, but this is so important. And so I want to know, and I have one question. We're getting to the what. What happened? We were glad that Florida led on that. Even while people remained locked down, we were trying to get to the answers. What happened? But in all of your reviews and what you've been able to compile and what you're saying today, what is the why? Why?
Why did the cover-up happen? I think there's a lot of incentives, misaligned incentives that have been created because of this highly opaque and complex system of laboratories, life science research. And the IC is just one component of that. Why did it happen inside the CIA and inside DNI and inside the interagency space when they were doing the analysis over the course of 4 years? Part of it is iron rice bowls. Your normal bureaucratic issues where one agency has this, another agency has that. There was groupthink. You could see it happening in real time as you read from beginning to end. I'll give you a couple examples. Every time there was an open source publication that came out, they're very good at grabbing that and kicking it up for the contracted scientists, the BSEG, to take a look at and assess. And the goal, it seemed, it always leaned one direction. They never took the publications from Sorensen and Dalglish, who came out very early. I think it was July 2020 that one of the best papers written was open source by Sorensen and Dalglish. They never took those papers and said, wow, we've got a lot here, we need to make sure we get this added in. Or Dr. Stephen Quay, for example, who had a lot to say about COVID origins. It was always one direction, and because the interagency space seemed intent on pushing it that way, and why the interagency space? I think the interagency space, I'm talking about the National Intelligence Council and the people responsible for that. I mean, these are people who have relationships with the National Academy of Scientists and the National Academy of Sciences. They've got relationships with the W&D community, and they're all part of this same, ecosystem. The planets are all revolving around the same star. And so you get groupthink. There's a multitude of reasons. I didn't find any smoking gun where they said, well, we got to cover this up because for sure the US government paid for research in Wuhan, China. But they were certainly well aware of PREDICT. They were well aware of the diffuse proposal that had circulated. And they had those products available to them. I think you get enough people shouting something down, it gets shouted down. And that happened repeatedly. I do want to just, if I can take just a moment, particularly about the scientists that are brought forward. I really, really want to emphasize a couple things. And one of it is we can't vilify these scientists. I'm going to give a very short anecdote, and I hope I'm not going over on time or anything like that. But when I got hired to the CIA, I can't tell you how proud I was. I really couldn't believe that they hired me. I'm sure there's some friends who are like, yeah, I can't believe it either. But they hired me because they saw potential to be able to be somebody who could recruit spies and steal secrets. That's my job. Imagine you're a scientist. Imagine the US government comes to you and says, listen, sir, you are a specialist in a field no one else knows about. And in fact, the whole point of a PhD is to push beyond what's known further than anybody else in a very rarefied field. Imagine you're a scientist and the CIA comes up to you and says, or the NIC, the intelligence community, comes up to you and says, you're special, not because we see potential, but because we know you're special and we need your help. We can't vilify these people who wanted to help. We can, however, boy, I might be contradicting myself here, but the system definitely needs a look because the system has been put in place now and you've got these same people that we've said, you're important to the IC. We just haven't done the proper work to ensure that those people who are important to the IC aren't cross-pollinated all over in other places so that they can incentivize the kind of research that we need done or the white papers we need written. We have to have a holistic overview. And I think it's really hard to have like one agency do their review, another agency do their review, the legislative branch do their review. In this case, it is a team sport.
So one answer also, Senator Moody, to your question about the why, people think, well, gosh, was there a conspiracy where all these evil people had their hands together and they were conspiring to do something bad? And I think George Carlin put it the best. He said it isn't required that you come up with a conspiracy where interests converge. And I think the interest is we funded a lot of dangerous research. Accidents have happened. This was an accident. In all likelihood, this was an accident. Even the Chinese probably didn't want this to happen in Wuhan. It was an accident. But the interest is that if you funded that research for 10 years, wouldn't I logically want to ask you why, why you did this funding. And so there are dozens of people throughout government who did cover this up, maybe hundreds, but they don't even know each other necessarily, but they had a hand in funding this research through the years. They've been in favor of it. It's been a big debate. For 20 some odd years, there's been a huge debate, maybe longer. People think this is the first virus that got out. One of the most, it's not as much reported, but one of the most famous viruses that got out was the Russian flu of 1977. And we're not sure it came from Russia or where it came from, but the interesting thing is nobody over 24 got the flu. Zero, not one person. Why? Because the Russian flu of 1977 had the exact same RNA structure as a flu in 1953 that had been kept in a lab somewhere. How do you get an identical virus 30 years later? Viruses mutate every couple of months like COVID has. There is no way to have an identical virus unless you got it from a lab. So proof positive that the 1977 flu actually came out of a lab. An accident, once again, an accident. There's a woman who's written about this. I think her last name is Young. She says that over a period of years, like 1,500 major accidents that she's cataloged. So it's not only about malfeasance, it's about safety of these labs. In fact, some people were finally convinced that this came from Wuhan because it was a BSL-2 instead of a BSL-4 for much of the time, that it didn't have enough safety precautions. But even the safest one, the 4, still has accidents. So maybe some of these experiments, we ought to reconsider whether we do them.
Thank you, Mr. Chairman. And it just goes to show why it's helpful to have a doctor as our chairman. You could also be a witness.
Thank you. We're going to conclude pretty quickly. I'm going to give Senator Johnson another chance if you have another question.
I've got a quick question, then I want to go someplace else. In September 2023, we apparently had a CIA whistleblower come forward, and there are news articles written about this, that 6 of the 7 analysts to describe this were bribed to change their analysis. Is that true?
No. So there's some clarifications on that. What is true, and I thank you for bringing up this question, Senator Johnson, because this is one of the things I wanted to make sure the record was corrected. So, and if I have just a few minutes here to sort of talk through this, there was new information that came out in 2022, and it forced the community to try and conduct a relook. There were 10 CIA scientists, I'm talking from the CIA side now, not on the NICS side, 10 CIA scientists that were said, why don't you go ahead and do a COVID relook? On that team, there were 7 SMEs, subject matter experts, technical experts with lab experience, medical experience, and so they began their relook. And by the time they wrote their paper, they wrote a paper and they said, we're assessing this as a lab leak. 8 of the 10, according to multiple whistleblowers, 8 of the 10 were definitely leaning in on lab leak. They sent that paper, that draft paper, up to the Weapons and Counterproliferation Center front office and said, take a look. And magically, a new report shows up that allegedly contradicted the information that had come in earlier that year. The multiple people we spoke to said, yeah, it didn't really contradict it. But they were told, go back to the drawing board and do a reassessment. So the interagency got involved. They were having discussions. So they go back to the drawing board. And by the time 2023 rolls around, they've got their answer. They say, 6 of the 7 technical people on that team. So there's 10 people on the team. 6 of the 7 technical experts say, yep, we still think it's a lab leak. We still think it's a lab leak. And they were sticking to their guns. Management changed the analytic line. They changed the conclusion to a non-consensus call. Actually, worse than that, they said that the exact words were, I don't want to get this wrong. Excuse me.
So one thing I just wrote in the chat, but I'm just curious of everybody's opinion. Please comment below. But I've been thinking about this all day. like, what is the motivation of this CIA or former CIA whistleblower to come out and talk about this stuff? And maybe I'm just overthinking it, and he really does have like good intentions, and he wants the American people to know this information. But the conspiracy theorist inside of me is questioning it, thinking, is this just controlled information, or are they trying to throw us off track by throwing out this information, or are they just trying to rage bait this side of the aisle? I don't know, but you know, I was really thinking about it earlier, and I want to reiterate for everybody that wasn't here the other night, no Democratic senator is present at this hearing. Nobody from the Democratic Party showed up for this hearing. None of them. And this really is not a partisan issue whatsoever. This is something that affects every American citizen. So it says a lot, but again, I'm not really surprised by it. But I would love to hear everybody's thoughts. Please comment below. What do you think the motivation is behind this whistleblower? Do you think that he just has good intentions, or do you think that this is kind of, like I said, like controlled narrative? I don't know. Let me know below.
We may never precisely know the origin of SARS-CoV-2. Precisely. Precisely is not a term analysts use. They use like low confidence, medium confidence, yes, no. Precisely is a word you use when you want to deliberately end discussion. Because do you know how many resources we'd need to precisely know the origin of SARS-CoV-2?
So again, I want the chairman to indulge me a little bit more here. There's no bribes paid. This was just a management decision. They overrode what the, okay.
But the financial piece definitely needs to be looked into, because they did receive an EPA. They got it. It's $1,500.
Okay, so it may be true then.
No. Let me be very clear. There were no bribes. They received an exceptional performance award. They were upset with it, and it was not a bribe. But what I will say,
okay,
the people who
they were rewarded for
their work. They didn't know they were going to get it.
Okay,
they were not.
I got you. Okay, I got you. And I understand this distinction. 1 point and 1 question. Just received this from Liz Lyon, the CIA Director of Public Affairs. The committee acted in bad faith by subpoenaing an agency officer for testimony today without notifying CIA. Despite having already obtained closed-door testimony from the individual previously, the witness testifying today is not appearing as a whistleblower in pursuit of the truth, but instead in response to the subpoena issued by Chairman Paul. This proceeding amounts to nothing more than a dishonest political theater masquerading as a congressional hearing, as the CIA has already assessed COVID-19 most likely originated from the lab leak, and efforts to undermine that conclusion are disingenuous. I'm calling on CIA Director Radcliffe and this person to apologize to Chairman Paul and this committee. This is not political theater. I have years and years and years of built-up frustration of agencies like the CIA, Department of Justice, the FBI, HHS, snubbing our oversight, giving us the big middle finger. And that really leads me into my question. You talked about how proud you were. Okay, I can imagine that. My belief is I'd say most people serving in government, all these agencies, are doing good work. They're patriots. Why aren't there more people like you? I mean, you saw Josh Hawley's, Senator Hawley's, the 5-page snub, the 5-page middle finger saying, any and all, this is it. And people inside the agencies know that's not the truth. They know that is a big, fat lie. What happens inside the agency that people, good Americans, patriotic Americans, people who believe in democracy, witness that and realize the agency they're working for is lying bold-faced to legitimate congressional oversight, legitimate congressional investigations to the American people? What is causing this?
2 answers. 1, we need more leaders like Director Gabbard, who pulls together a task force of people to actually pursue this, despite the difficulty in wrangling agencies to do the right thing. I think the second thing I'll say is it's a minority of officers. I mean, most of the people joining the CIA are barrel-chested freedom fighters. Like, they're out there wanting to do the right thing. As you matriculate upwards into the bureaucracy, I just think that it gets easier and easier to find people who are more willing to get along. And you know, if we want to link this back to COVID, you had a bunch of refuseniks out there that said no, and they were trying to push these people out. And what you really need in these organizations, you know, you can't have the whole organization saying no to everything because nothing gets done. But you got to retain the people who are sometimes a little more difficult to deal with, more willing to say no over and over. And I think we've created a milquetoast bureaucracy. You know, when I first joined the agency, the chiefs of offices had a lot of power, you know. And then modernization happened, and they watered everything down. And the accountability piece has to be there. Otherwise, this is just going to keep happening.
Well, again, I appreciate you coming forward. Again, I'm calling on Director Radcliffe and that communications person. This committee, this chairman needs an apology. This is not political theater. This is serious oversight work. This is what the American people need to see. And I just wish our Democrat colleagues had any level of curiosity what's happening inside the deep state. Thank you, Mr. Chairman.
Thank you, and I completely.
You know, I really appreciate Senator Johnson. I mean, he has done so much to just research himself and try to uncover what really happened during COVID and the lockdowns and what's really in the vaccine and, you know, what the side effects are and what's been covered up. And he's really made this his mission over the last few years to uncover these things and bring them to light. And, you know, you can see and you can hear in his voice how passionate he is about it. And again, I really appreciate what he's done. And I absolutely think he's right. He deserves an apology. He deserves recognition for what he's been doing. But he has been disrespected like unbelievable amounts from the Democratic Party and from the Biden administration. Like basically like gaslit to the max over the last few years. And now finally he's getting the confirmation that he knew all along that everything that he had uncovered and all the hunches he had were correct. And there's all these cover-ups and the vaccine wasn't what it was supposed to be and has been causing severe issues for some people, death for others. But I'm really glad that we have Senator Johnson, and I'm really glad that he didn't give up this fight, because it would be really easy for him to just throw in the towel, you know, 4 or 5 years ago when he started to uncover all this stuff. But he's hung in here. You know, it's 2026 right now. COVID lockdowns were 2020, 2021. So he's hung in there for us, and I just wanted to give him a shout out. I really do appreciate the things that he's done to uncover this.
Concur, and I would also like to respond to the CIA spokesman. They say that we have already obtained closed-door testimony. Well, closed-door testimony doesn't provide oversight. Public testimony provides oversight. We have asked them for public testimony and for oversight. We would love to have the scientists the 6 or 7 scientists that were commissioned to look at this, we'd love to see their report. Why would we not be allowed to see their report? I can't even read that in private. But that should be public, the science. If there are sources and methods, mark them out, redact them. But we should be able to see that. But for them to have the gall to say, oh, we allowed the witness to testify in private and that should be enough. No, you were told by Congress unanimously to declassify this material, and you send us 5 pages. Imagine how many, you mentioned maybe 2,000 pages. DOE has a report. That's got to be 40 or 50 pages, but the base documents for DOE's report are probably run into the hundreds of pages just for that one report. And they did a great analysis of this, but still most of that is not available to the public. Why does it need to be available? Because this is going to happen again, and we need to be prepared, and we need to talk about it. One of the other things we didn't get to in this hearing, but we need to talk to, how do you prepare for the next pandemic? Well, one of the things that actually worked was monoclonal antibodies. We need to be talking about how we can quickly
We don't need another pandemic to prepare for. I don't like that statement. I don't know if I believe these pandemics are real. I don't know if, certainly the majority of the American people are never going to fall for a pandemic scare again. Unless people are like dying in the streets, like passing out in the streets, there's like a zombie apocalypse. Like, we're not doing this again. Not here in a red state. That's absolutely not going to happen. Nobody is ever going to trust the science anymore. Nobody's going to lock themselves in their house because our government says, oh, this is the deadliest disease ever and you need to wear a diaper on your face. Like, we're not doing that. We're not doing that here in Florida, I can tell you that. I don't know what like some of the blue states are doing, but we won't be recognizing a pandemic ever again in Florida.
Produce them again, how we can quickly get started on things like that. What worked and what didn't work. Masks didn't work. 6 feet of distancing, there was no science. They say follow the science, and yet it looks like everything that happened at the CIA was the politicians overruling the scientists. The scientists were concluding this came from a lab leak, in all probability. The politicians were overturning them once at 2 in the morning. So that is one of the takeaways from this, is that, yes, follow the science and the scientists, and that the scientists need to not have a conflict of interest. Which leads me to the final point I'll make before we conclude. I applaud the Trump administration for an executive order saying no more gain of function. It is head and shoulders above anything. The Biden administration really didn't do much of anything on this. The Trump administration is trying to live by that. The reason it won't work forever is that people who have a Weasley way with words, let's say Anthony Fauci, will come back into play, and half of his lieutenants probably still work over there. One of them will get in power again, and all they will simply say is, oh, creating that new virus that grows 10 times faster and grows better in human cells, oh, that's not gain of function. Because that's what Anthony Fauci was doing. He was still doing the gain of function research. He was just saying, oh, the way I look at the definition, that's not really. So we do need a commission. And what I proposed is the Risky Research Review Act. There'll be a presidential commission. It'll have scientists on it. They will be experts, but they will not be currently in the employ of government competing for grants. I think that is a conflict of interest. They have to be people outside of it. There also will be some people who are national security experts as well. And we have to look at the list of things. One scientist, Dr. Esfelt, ordered off the internet under Biden's policy. He ordered snippets of DNA from here and here, chopped them up, put them together, and he made the Spanish flu. Now, he told the FBI he was doing it because he wanted to prove a point. He didn't create the infectious portion of the Spanish flu, but he said, look, I can do it by just ordering DNA. So there are a lot of things that have to be addressed, and unfortunately, it's somehow a partisan issue, and we're not getting anywhere. But I want to applaud you for your courage in coming forward. You did come forward at the response of a subpoena. That is a lawful subpoena, and I see no reason that anyone should try to punish you. If anybody does try to punish you, I can promise you that we will defend you. Thank you very much.
Thank you, Senator.
Meeting's
Paul.
adjourned. Thank you. Yep. I would like to thank our witness for joining us here today to share his testimony and expertise with the committee. The record for this hearing will remain open until 5 p.m. on Wednesday, May 13th, 2026 for the submission of statements and questions. For the record, the hearing is now adjourned. Thank you.
Okay, guys, give me 1 minute. I have another Senate hearing, COVID related, that's all teed up. Just give me 1 minute to change it out. I'll be right back.
Hoya lady asked how Biden health officials purposely turned a blind eye toward COVID-19 vaccine, or I call them injection, injury, safety signals. I urge everyone tuning into today's hearing to read.
So this is actually different than the hearing that we streamed a few days ago. This was like the origin hearing where Senator Johnson, really gets into what the vaccine really is and how all of the signs that there were dangers associated with it were covered up. So that's what this hearing is. But thanks for staying with me. Let's get going.
Read the full report to determine for yourself how the title is as accurate as it is incriminating. To set the stage for what follows, let me remind everyone that Dr. David Morans, now indicted for this, under conspiracy and destruction of records charges, he was an advisor to Anthony Fauci, emailed to colleagues on how to evade freedom of information requests. Quote, I learned from our FOIA lady here how to make emails disappear, and how he wanted, quote, correspondence on sensitive issues to be sent to me at my Gmail address, unquote. Included in this report is additional evidence of how federal health officials avoided creating a paper trail to prevent transparency and public disclosure. In discussing how they've been warned of a major limitation of FDA's data mining system, one senior FDA official wrote, quote, we should meet internally. Many considerations not suited to email, unquote. Other federal officials appear to have openly acknowledged that they were actively attempting to avoid transparency. A CDC official discussing the sharing of vaccine safety data stated, quote, I think because of the FOIAs, we may have asked FDA to stop sending these weekly data mining outputs, unquote. In spite of their concerted effort to conceal what they knew and when they knew it, documents we've retained, thanks to Secretary Kennedy's responsiveness to my subpoena and his commitment to radical transparency, paint a clear picture of an obvious cover-up by federal health officials. Our report shows how FDA officials were warned and fully aware of their safety surveillance system's inability to adjust for a statistical phenomenon called masking, which according to medical researchers occurs when, quote, signals for a vaccine of interest are hidden by presence of other reported vaccines, unquote. Rather than use a newer state-of-the-art system that can adjust for masking, Biden health officials purposefully chose to employ the older system that conceals the signals for serious adverse events associated with the COVID injection. Throughout 2021, FDA officials received multiple analyses from the state-of-the-art system showing statistically significant safety signals for adverse events, but made a conscious decision to ignore that data. On October 22, 2020, CDC's Tom Shimbukuro touted VAERS by saying it can, quote, rapidly detect safety signals and can detect rare adverse events, unquote. But in an email a year later, when VAERS was reporting worldwide adverse events of 837,595 and 17,619 deaths, Dr. Shimbukuro stated, quote, it's not a database that should be used for serious surveillance and research. And we have up on the screen a chart that I produced almost weekly once I started tracking this. And you'll notice it compares.
Okay, let's unpack this right now because I'm looking at this. It's a little shocking. So Senator Johnson put together his own reporting. One side, it has the adverse effects from the COVID vaccine, the COVID mRNA vaccine. So 837,595 adverse effects. And it looks like 17,619 deaths. And this is from the COVID vaccine. The vaccine that we were told if we didn't get, we would be infecting everybody with COVID and everybody would die on the streets from COVID. Trust the science, get the vaccine. There's nothing to be worried about. It's totally safe. Forget the fact that, it was brand new, experimental, it, only was researched for 8 or 9 months. Perfectly safe. And if you don't get it, you can't leave your house, you can't travel anywhere, and in some situations, sorry, you can't work. So this is what we were presented with in 2020 and 2021. And then, and to me, this is like the most infuriating part. People were coming forward and they were reporting these adverse effects. And some people noticed immediately and had major, major adverse effects or adverse events. And they were basically told that they were crazy, that no, I'm sorry, it wasn't from the vaccine, couldn't be, this is perfectly safe, trust the science. But I know people firsthand that had major issues after getting the vaccine and still have issues to this day. And like I said, like the medical world was just telling them that they're crazy, that it could not be from the vaccine, yet they had no issues and the only variable was the vaccine. But let's keep going. Oh, well, the other thing I wanted to say though, first of all, is remember on all the TV channels, like all on the news and MSM, they had the COVID death ticker, and you know, they would, this is so crazy that this is what we lived through. You know, when somebody died, you know, they would add the death, the real time, the COVID death ticker. That's what we would see on Fox and CNN and ABC and CBS. But they don't want to show us this information, the real information of actually people that had terrible adverse events and deaths, not from COVID, but from the vaccine.
Different drugs, adverse events reported, those things, deaths per year. You can see at the top of the chart, ivermectin appears to be a pretty safe drug. At the very bottom, COVID vaccines, and again, this is in October of 2021, 17,619 deaths. It's important to note that 32% of those occurred either on the day of vaccination or within 1 or 2 days of vaccination. I know VAERS doesn't prove causation, but that is a correlation that federal health officials ought to be looked at. In reaction to the skyrocketing number of deaths and adverse events, other Biden administration and federal health officials were also publicly denigrating VAERS with comments like, quote, falsified VAERS report, potentially misleading VAERS posts, frequently misused by anti-vaccine activists, and quote, conspiracy theorists, science deniers, and anti-vaccine activists can fill out the form. Now, this is quite honestly contrary to reports in terms of the high percentage that are actually reported by medical professionals. The federal health agencies had to be sued twice before a court finally forced them to disclose the results of the VSAFE system, an online self-reporting safety for surveillance system created specifically for the mRNA COVID injections. Here's why they fought so hard to keep that from public view. Of the 10 million people who voluntarily provided information to VSAFE, 7.7% sought medical care for COVID injection adverse events, and 25% lost time at work or couldn't perform their daily routine following injection. Even though I wrote 21 letters requesting information on what the agencies were tracking and what they knew about adverse events, I didn't need sophisticated mathematical models to tell me the COVID injection was causing significant harm. The data depicted on these charts alone should have raised the alert level to DEFCON 1. Now, this first chart is showing deaths reported on VAERS since the inception of VAERS. You can see starting in 1990, deaths were approximately a couple hundred per year, anaphylactic shock, those types of things. In 2021, deaths spiked to 21,631. Now, again, I didn't need a mathematical algorithm to tell me there's something going on here. And by the way, a lot of people will say, well, that's because we administered billions of doses. One of the letters I wrote to the CDC showed the rate of death per dose, compared it to the flu, which is about 0.46 deaths per million doses. Time we calculated this, the COVID injection was 25.5 deaths per million doses. That's a 55-fold increase over the deaths for the flu vaccine. So something was going on here. Our federal health officials should be paying attention. Let's do the next chart. This is the most up-to-date VAERS chart now. It's showing 39,077 deaths worldwide reported to VAERS. And understand, and we'll be adding this to the the record, the Pilgrim Report, an HHS-funded Pilgrim study at Harvard University showed that adverse events for vaccines are reported at less than 1%. So this grossly understates the number of adverse events and deaths, and you can see adverse events are almost 1.7 million. Multiply.
So I just want to make sure you guys all caught that. So what he's showing you are reported adverse events and reported deaths caused by the COVID vaccine. But he said something very important that you have to understand. He said only 1% of people that have an adverse event or die actually gets reported to VAERS. So that means 99% of people that had an adverse effect or an adverse event from the vaccine, it didn't even get reported. I don't even know what the math of that would be. I don't know if you would multiply 1.675 million by 99, or I don't know. I'm not a math person. I'll figure it out. But if this is just 1% of the population that's reporting, and 99% doesn't report but had an event, that's really scary. That's a lot of people. I mean, one person dying from this vaccine is too many, in my opinion. But close to 40,000, and that's not even the real number. I don't even think that's the real number by a long shot. Because if you guys remember too, hospitals and physicians were labeling people COVID deaths. And they weren't all actually COVID deaths. And I've actually heard several people tell me personally that this has happened to them, that a family member died of something else, but on the death certificate, they put COVID. And the reason they were putting COVID is because these hospitals were getting paid like additional money. If they were treating COVID patients, or if somebody died of COVID, they were getting extra funding for that COVID death. Now, I'm not 100% sure what that number was. I thought it was in the like tens of thousands, but one of our members was saying the other night some crazy number like $800,000. I don't know. I don't know what the real number is. But hospitals were incentivized if they had these COVID deaths. So 100%, they were inflating them. If they were going to get more money because somebody had COVID or somebody died for COVID, they were going to inflate it. It's not ethical whatsoever, but if you've ever had to deal with a hospital system that's for profit, you learn pretty quickly it's all about the money. Let's continue though, but I just wanted to make sure you guys understand these numbers and what they mean, and how this isn't the true number. This is like a minuscule amount. These are just what was reported. And I can guarantee you, people reported stuff and it wasn't sent to theirs. Like I know that. I would love to know what the actual number is of how many people really truly had an adverse event after taking the vaccine, but I don't think we ever will know. But this is quite shocking.
That time is what, 100? 30? These are dramatically understated. In spite of these shocking numbers, federal health officials continued to recommend the injection, claiming it both safe and effective. By comparison, in 1976, after approximately 25 to 30 deaths and over 500 cases of Guillain-Barré syndrome, the swine flu vaccine was pulled from the market. Biden federal health officials were clearly not as vigilant in reacting to what VAERS was showing. For over 4 years, I have wondered how health officials could possibly ignore this overwhelming evidence of harm. Now I know. Our report details that on March 1st, 2021, less than 3 months after the COVID injections received an emergency use authorization, Peter Marks, the head of CBER, and officials reporting to him were warned by FDA's Dr. Anna Scharfman, and an individual who these officials recognize as an expert in FDA's data mining, that the current system would mask safety signals for COVID injection adverse events. Dr. Scharfman proposed a new model, a new method, invented by Dr. William Dumichel of Oracle, the inventor of the current algorithm, to uncover the hidden safety signals. On March 26, 2021, 26 days later, Dr. Scharfman sent Dr. Dumichel's data analysis to senior FDA officials showing that the new analytical method found, quote, 49 examples of extreme masking and uncovered approximately 25 statistically significant safety signals of adverse events associated with COVID injection, including, let's put up the next chart here. Here's the sheet. These are the adverse events that they were showing a safety signal for using the new method: Bell's palsy, sinus rhythm, cardiac failure, chronic, acute left ventricular failure, agonal rhythm, which is severe arrhythmia generally occurred at the end of life, pulmonary infarction, cerebral artery occlusion, aortic stenosis, sudden cardiac death, hypertensive emergency, basal ganglia stroke. Now these aren't minor. Remember, we're always told, adverse events are rare and minor. These are not minor adverse events, and these safety signals were showing, and they were strong, but they were being hidden because FDA officials refused to acknowledge that the current system they were using was invalidated, and they had to look at the new system that unmasked these things. Our report goes on to detail how federal officials refused to acknowledge these revelations or take action to warn the public. Instead, senior FDA officials repeatedly tried to stop Dr. Scharfman from continuing her work or communicating her findings outside of FDA. In September 2021, Dr. Marks informed Dr. Patricia Cavazzoni, the then director of CDER, that Dr. Scharfman, who was a CDER employee, quote, has been asked to cease and desist conducting her data analysis. Dr. Marks complained that Dr. Scharfman's work had become, quote, a major distraction, that her efforts could create erroneous conflicts that feed to anti-vaccination rhetoric. Dr. Peter Stein, the then director of CDER's Office of New Drugs, reported to Dr. Marks that his office had, quote, made it clear to Dr. Scharfman, quote, that she should not be discussing and providing internal analyses externally and needs to focus on her assigned work. Dr. Scharfman, who retired from the FDA in 2025 after more than 35 years of service, told PSI staff in a recent interview that she believed her FDA colleagues saw her as a, quote, pest and, quote, persona non grata, unquote, because she was raising concerns about masking. Our witnesses today are medical researchers and experts in scientific data collection. They will help clarify the masking issue and describe why this cover-up was so egregious. I want to thank them for their time and effort they put into our testimony. I also want to thank Secretary Kennedy for his commitment to radical transparency and for promising to make HHS personnel with knowledge of these events available for interviews with subcommittee. And I also want to give a huge shout out to my staff. These are the folks who found a needle in a haystack in a document production from one of the universities that we were investigating 2.5 years ago, found that David Morin's email where he was talking about being able to, being told how to make emails disappear and to use his Gmail. So these are the folks who did that, and these are the folks who have combed through 11 million pages to find and discover this egregious cover-up. So thank you, guys, and with that, I'll turn it over to Senator Blumenthal.
Thanks, Chairman Johnson. Amid everything that's been said, I think we ought to remember what it was like during the height of the COVID pandemic. Literally, the fear, the death, the loss, and then the relief as a result of Operation Warp Speed, which President Trump ordered, in having a vaccine that gave people hope and many people life. At the same time, none of the relief or hope enabled loved ones to come back. They lost lives, and families had their lives upended, and we can never forget the heroes in our healthcare system who braved COVID in delivering care to people who needed it in hospitals, many of them for weeks, sometimes months. We are fortunate to have with us Maria Young. Thank you for coming here today, who spent many days in a hospital, close to 70 days in intensive care. Most lives were forever changed as a result, but the vaccine offered a path forward for so many people, and we should be thankful for Operation Warp Speed. In January 2021,
No, I hate this BS. This is such BS. Okay, yeah, people were scared because our government with the MSM like threw out all this BS and propaganda to make us scared. And we just heard the same propaganda, the same lies over and over and over. And like I talked about earlier, there was literally a COVID death ticker like on the top of the screen on every major news channel. So yeah, it was scary because you guys made it scary. You guys purposely scared not just the American people, but all over the world. People were scared because every minute of the day, you reminded us that we could die. And nobody wants to be reminded that every minute of the day. And you guys manufactured this anxiety and this fear and just made up BS and nonsense and told us that if we didn't do all these steps that we were going to infect our loved ones and we'd be dying in the street. Or if we didn't do these things, we're a horrible, evil human being that didn't care about anybody else's lives. But all of it was made up BS. Nothing that they told us to do actually worked. And all of these remedies that they told us that we had to do, or we were horrible people and we would all die in the street and have like a dark winter or whatever Biden said, were made up BS that actually made things much, much worse. People that got the vaccine had terrible adverse events, or they died from the vaccine. People that wore their masks day in and day out started to get respiratory issues, started to get other, even minor issues. I know a lot of people that just got a lot of like acne on their chin area from all the bacteria from the mask that didn't even work. Like, it didn't work. They made this up, and I don't want to hear the sob story from him that we were all scared. We didn't have to be scared. We could have just been given like accurate information. We could have been told, hey guys, like, we're American citizens. We're the best country in the world, and we're strong here. Our advice to you guys is to get outside, get sunlight, get vitamin D, take zinc, take vitamin C, take vitamin D, eat meat, eat healthy, exercise like I'm doing right now, build your immunity, and you can fight this disease by having a strong immune system, which is the truth. But we were told that all of that is just like quackery, like, you know, vitamins and supplements aren't FDA approved because, you know, the FDA can't patent a vitamin. So, you know, that's quackery. That's not real medicine, right? So I don't want to hear it from this guy. Like, it's just all BS. They made the problem. They pretended to make a solution, but what they ended up making was just a much bigger problem.
more than 20,000 Americans were dying each week from COVID-19. Between 2020
Allegedly.
and 2025, more than 1.2 million Americans lost their lives to COVID-19. That's 1.2 million parents, children, friends, loved ones. And those deaths changed not only their families, but their communities and our nation. Husbands lost wives, parents lost children, and in addition to those who perished, millions were infected and many of them suffered life-changing injuries from the virus. And employers suffered economically, as did our overall economy. And
yeah, our economy suffered and workers suffered because you made us stop working. You would not let us leave the house. And it was very unfounded and very unscientific that they made this decision. They caused the problem. No solutions, they just made the problem worse. All our government's fault.
the survivors still bear, many of them still bear the scars of that experience emotionally, if not physically. Years of scientific analysis have shown that COVID-19 vaccines saved lives and prevented serious.
No, but that is a lie. That is completely a lie. Prove that. There's no proof to that. And there's never going to be any proof to that because everything has been skewed. If you have no truth, literally no truth, you hid all the results, all the adverse events, then you can't turn around and say, oh, this is how many people it saved. You don't know that to be true. There's no proof. They're just making up words, making up numbers. It's not true whatsoever.
Illnesses like the one that Ms. Young suffered. I don't agree with President Trump on a lot, but I have to give him credit for the work that was done to create COVID-19 vaccines in record time. But instead of talking about the success and remembering the ones we lost, vaccine opponents have turned one of the greatest scientific breakthroughs in our country's history into fodder for political attack. I don't get it. Today's hearing purports to discuss a cover-up of side effects of the COVID-19 vaccine, as if serious flaws in vaccines were purposely ignored. And let me be clear, they were not ignored. They were not disregarded. They were not covered up. The majority's report cherry-picks emails and misconstrues an internal debate between scientists who were actively looking for ways to detect side effects to support a predetermined and flawed thesis that COVID-19 vaccines have done more harm than good. That's not the scientific method, to have a preconceived result and then frame the evidence to fit the outcome. The report and documents that the majority has released simply do not support the notion of any kind of cover-up, nor do the reports and documents do anything to change our understandings of the vaccines as safe and effective. These points are important for the public to understand. And with all due respect, nothing that Chairman Johnson has released shows the vaccines were linked to any adverse effects beyond the rare ones that health officials have acknowledged.
Oh, is 1.67 million rare? Is that rare? Is that a rare number? I don't think that that's a rare number. It's 39,000 deaths from the vaccine rare. Maybe I just don't know anything. Maybe I'm not good at math. But I feel like that's a lot. That's a lot. And we're not talking about, over 100 years. Like, it just came out a few years ago. So 39,000 rather, documented deaths, and this is really just 1% of the population that's documented. Like, that seems like a lot. That doesn't sound rare.
Indeed, the risk of stroke he claims was hidden not only was studied openly, but later shown not to exist. Without objection, I would like to enter into the record the 4 studies demonstrating that COVID-19 vaccines and boosters save lives, Mr. Chairman.
Without objection.
There is also a really deep irony in the majority's argument given the current administration's overt effects to skew science and undermine public health. Last week, I wrote to the acting CDC director, Dr. Jay Bhattacharya, about reports that he has blocked publication of a recent study showing that COVID-19 vaccines were extremely effective at preventing hospitalizations last winter. That study still has not been formally released, although I understand that.
Oh, it hasn't been formally released, guys. So just trust the science and listen to what he says, because it must be true.
A copy was somehow leaked, literally hours before this hearing. Magically.
Sounds kind of fishy. This guy is a clown. Clown maxing tonight.
Released, but not officially. And therefore, I call on the CDC director to officially release that report. Again, I asked my letter to him to be entered into the record if there's no objection.
Without objection.
I sincerely hope we never face another pandemic. I think most Americans join in that hope. And that we are still able to find dedicated scientists and, yes, pharmaceutical companies willing to work around the clock to find vaccines and cures, and public officials who are willing to support and encourage and to fund them with resources. I fear that this administration's actions to politicize science and slash scientific funding and to expel talented scientists are doing irreparable harm to our nation's ability to counter the next pandemic. The threat remains real and present, and we must respect science and encourage our scientists to continue to do their work. Thank you, Mr. Chairman.
Thank you, Senator Blumenthal. Before we swear in witnesses, I'd like to enter a number of records into the record. First, the majority staff interim report and the 596 pages and 10 spreadsheets that support that report. Second, my December 15th, 2025 letter to HHS Secretary Kennedy requesting information about an internal FDA memo on deaths of children following COVID-19 vaccination. Then my March 23rd, 2026 letter to Secretary Kennedy detailing the subcommittee's findings about masking and how federal health officials ignored and downplayed the risk of ischemic stroke following vaccination of Pfizer's COVID-19 bivalent booster. And finally, the 2010 report entitled Electronic Support for Public Health Vaccine Adverse Events Reporting System. Again, this is the what they call the Pilgrim study done by Harvard. So I'd like to enter those in the record.
Mr. Chairman, as I indicated previously, I have a Judiciary Committee hearing, and I'll be right back.
Okay, sounds good. Without objection on my entering records into the. So it is the tradition of this subcommittee to swear in witnesses, so if you all rise and raise your right hand.
For those who are just joining us now or didn't hear the hearing before this, Senator Ron Johnson has made it his mission to uncover all the treachery that has gone on in relation to COVID. And for years, he was mocked, called a conspiracy theorist, a liar, could not get the information that he requested right away. But he was on a mission, and he was stubborn in a good way, and he kept on this. And he has so much data now on what really happened during the COVID lockdowns, what happens in the lab, where this disease came from, who was funding this research, and all of this information about how we probably should not have been, well, we shouldn't have been mandated to have to get the vaccine, but no human being should have been given the mRNA, according to Johnson. And if we were still under Biden or Kamala or whatever, we would never get confirmation that all the stuff that he uncovered is actually true. Because there has been a mass effort to conceal all of this. And I think a lot of us watching this, like, knew all along that there was something up, that this was really fishy, that it was a lot of propaganda. But now we're getting to the bottom of it, and we're getting the actual proof that everything that we thought, that we were called a conspiracy theorist about COVID and the vaccine and all that, like, people that question it and refuse to get it were actually right. And thanks to Senator Johnson and the Trump admin, we're getting that confirmation now.
Do you swear or affirm the testimony you will give before this subcommittee will be the truth, the whole truth, and nothing but the truth, so help you God? Please be seated. Our first witness is Dr. David Wiseman. Dr. Wiseman is the president of Synekion. Did I get that close? Pretty close. Synekion. There you go. I actually practiced that beforehand, and I still blew it. An R&D company focused on fibrosis and pain. He received his PhD from the University of Manchester and has a background in experimental pathology, pharmacology, and immunology. From 1987 to 94, he worked at Johnson & Johnson, rising to the position of research fellow, leading a program that included pharmacovigilance. Dr. Wiseman has published in numerous top scientific journals, including the Journal of the American College of Surgeons. Dr. Wiseman.
You hear me? Distinguished Chairman, Ranking Member, and committee members, with today's stunning revelations, I am humbled to discuss critical flaws in statistical safety signal and potential risk detection in VAERS, touted by CDC as the nation's early warning system for vaccine safety, and credited by former CBER Director Marks with detecting both potential and actual safety issues and informing vaccine policy decisions. Among limitations undermining detection of statistical safety signals is the problem of masking. Masking occurs when statistical signals for one vaccine in a database are obscured by reports associated with other vaccines. For example, Moderna's myocarditis signal becomes hidden if its comparison baseline is artificially inflated by including Pfizer's myocarditis signal reports. In a simple analogy, hemlock and arsenic appear equally toxic when compared separately with a non-toxic baseline control such as tea. However, if hemlock's baseline data include arsenic data, hemlock's signal is drowned out or masked, appearing innocuous. Today's report shows that senior FDA staff were apprised of the masking problem both prior to COVID vaccine rollout and repeatedly by Dr. Anna Schaafman. Dr. Schaafman is a veteran FDA statistician lauded for bringing the empirical Bayesian method into FDA after collaborating with its inventor and developer of the associated Empirica signal software, Oracle's Dr. William Dumichel. Schaafman communicated Dumichel's findings of extreme masking, including death, myocardial infarction, stroke, and dementia, noting that I am not astonished that FDA's analysis was unable to detect these signals. She repeatedly advised colleagues of Dumichel's improved procedures, not brand new, they'd been around a while, to address masking in the same Empirica signal software used by FDA and commercially available. Nonetheless, officials attempted to contain Dr. Schaafman, asking her to cease and desist. Elsewhere, officials claimed ignorance on how to address masking and that developing solutions exceeded FDA's capabilities, considering it problematic to use a brand new, possibly unvalidated tool in the context of an EUA. FDA had validated methods adaptable to demask signals. In a special data run in the new documents, FDA's Dr. Menshik found a muting trend yet to appear in the record. In the related PRR, or proportional reporting ratio analyses required of them by the VAERS standard operating procedure, CDC somewhat accounted for masking. In 2022, Schaafman and Dumouchel published in the leading journal Drug Safety their masking concerns and the improved method, unmasking hundreds of statistical signals for the COVID vaccines, consistent with my analysis. Despite possessing both software and in-house expertise, regulators failed to implement this solution to correct for masking, a striking failure given the accelerated population scale deployment by Operation Warp Speed of a novel and most complex class of drugs ever, mRNA. Compounding further, CDC considered that its PRR analyses were rendered basically redundant by FDA's Bayesian work, discarding its responsibility to generate these PRRs. Accordingly, the United States lacked a fully functional early warning system at the time of its greatest need. Separately, statistical signals were trivialized by avoiding the terms signal or potential safety signal. These failures are incompatible with the so-called enhanced surveillance required by VAERS standard operating procedures. Hindering investigation of potential risks, FDA was obliged to consider, even without having to prove causality, and impugning vaccine injury compensation, authorization, and approval decisions, principle of which was Comirnaty's hastened full approval undertaken while Dr. Schaafman was voicing her concerns. Further, they marginalized those apparently injured by COVID vaccines. Not only did the system fail to perform as advertised, but as the drug safety paper presciently warned, the COVID vaccine reporting deluge likely created masking effects that now compromise signal detection for other vaccines going forward, and there are several papers that describe this. Regulators must swiftly correct masking and other VAERS deficiencies, heeding earlier warnings of their former colleagues, Drs. Marks and Jernigan, who said, failure to detect and communicate a serious health issue related to vaccines could impact confidence not only in COVID vaccines, but in all vaccines. Thank you. I welcome your questions.
Personally, I am very skeptical of all vaccines at this point. And I was never like that. I have 3 children. And when I had my first child, we were all about getting her vaccinated. We listened exactly to what our pediatrician told us to do. And we were under the impression that, babies needed vaccines so they didn't get, these deadly viruses. And at the time, my sister-in-law, she's a nurse or a PA now, but anyways, she was very skeptical of the vaccines. And she would, talk to me and my husband about it and kind of warn us, to be wary of certain things. And to be honest, at first, we kind of, made fun of her. And I think we sent, a meme of, a family from, the 1800s all dying of, the plague, okay? So we were all about getting the kids vaccinated, following that schedule. But along the way, our kids had a few issues with a vaccine, a bad reaction, and then my daughter actually had a bad reaction to amoxicillin when she was 15 months old. And I really lost faith in, the medical establishment having to deal with that because, it's a long story. Maybe I'll tell it another day, but they get so hung up on wanting to be right about a diagnosis that they won't listen to anything else. And if I wasn't persistent about my daughter's health and what I thought was going on with her, she may not have made it. And when it turned out that I was right and that the diagnosis that they gave her was completely wrong and I was right, they wouldn't even change it in her charts. A doctor confirmed it with me, But when they sent over the information to her pediatrician, they wouldn't change it. They wouldn't even put in writing her real diagnosis. And then the other thing, and this reminds me of like the COVID vaccine. So I had gotten my daughter like a flu shot. Like they were really pushing that. Again, this is when, she was young and I didn't know any better. So she was perfectly healthy, fine. Went in, she got the flu shot, and then probably within 48 hours, she started having flu symptoms. So I called the pediatrician's office to tell them, hey, I think she's having a bad reaction, to the vaccine. She was fine before this, but now she's having, all these symptoms. And they literally told me, oh, it couldn't be from the vaccine. She must have been sick before she came into our office to get it. That's what they told me. So, I think that says it all. But when COVID lockdowns were going on, I had a lot more free time on my hands. And when they were really pushing the vaccine, luckily my physician did not believe in the COVID vaccine and told me and my husband, don't get it. So then I started doing some more research. And long story short, I would never vaccinate my kids again. I don't know what is in our vaccines today, but if I had to go back in time, I wouldn't have gotten them vaccinated. And my youngest, she was a baby she was just born like right before COVID lockdowns. So she had maybe like not even a full round of her shots. And I never gave her any shots after that. And I have to tell you, she is the healthiest of the bunch. Like sometimes my older two will get sick and maybe they're sick for a week or sometimes 2 weeks at a time from whatever. My little one, from never being vaccinated and just like having her own good immune system, like last time she was sick, she was literally sick for 12 hours and then she was fine.
Thank you, Dr. Wiseman. Our next witness is Dr. Karl Jablanowski. Dr. Jablanowski is the Director of Science and Research at Children's Health Defense. He holds a master's degree in computer science from the University of Chicago and a PhD in biomedical and health informatics from the University of Washington School of Medicine. His research focuses on bringing about an end to childhood health epidemics. Dr. Jablanowski.
Thank you, Chairman. Pharmacovigilance is absolutely necessary. Our knowledge is limited, even of a vaccine that passes clinical trials of a few thousand very healthy people. We simply do not know what adverse events look like in a diverse, large population until they're administered to a diverse, large population. We had better be watching very closely, which is pharmacovigilance. The vaccines, by honest accounting, were pathetically tested. Pre-EUA, no drug-drug interaction study, no cardiovascular toxicity, central nervous system toxicity, other organ toxicity, blood toxicity, genotoxicity, carcinogenicity. Had they actually turned out to be safe, it would have been serendipitous, a happy accident. Luck is not a pillar of public health. Pharmacovigilance behind closed doors should give everyone pause. It is simply too important to not do it correctly. Lapses can be and were catastrophic. The vigilance heavily depends on three sources of data: the passive surveillance of VAERS, the active surveillance of vSafe, and the VSD, an active system linked to medical records. vSafe was designed to collect inconsequential data. One of the first papers to publish it was a mortality and adverse event study. The only figure in the entire paper was a time series comparison for both Moderna and Pfizer, for both dose 1 and dose 2 of adverse events no one cares about: injection site pain, fatigue, headache, myalgia, chills, and joint pain. Dr. Renata Engler is distinguished in the study of vaccine-induced myocarditis among U.S. military with 4 publications on the smallpox vaccine. On the CDC not including myocarditis in vSafe, she asked, "If you do not ask, you will not see it. But does that mean it does not exist?" Within 50 days of that meeting, Dr. Engler would start adding 4 more publications on COVID-19, vaccine-associated myocarditis. The CDC already had in hand Israel's slides. The vSafe system had 10 million volunteers. About 1/3 entered free text. Perhaps there is some horror found in the 366 individuals who typed in myocarditis, a condition requiring medical diagnosis. That is amplified by the nearly 50,000 people who typed in chest pain. The Vaccine Safety Data Link is a collection of 13 healthcare organizations covering 15.5 million people. It can detect safety issues within a few weeks. Most frequently used is rapid cycle analysis, which can miss delayed onset events. Better and timely options, like the vaccinated versus unvaccinated or pre-post, is rarely used. And they would need the well-practiced extra step of considering differences in healthcare-seeking behavior. By the time the CDC's webpage was updated to warn of inflammation of the heart, 313 million doses were administered to 173 million people. I do not see vigilance at work. With VAERS, the CDC chose to ignore its own standard operating procedure and not run proportional reporting ratios in favor of the FDA's, what Walensky calls more robust and Shimabukuro calls the gold standard. VAERS had been grossly underreported for the first 30 years, maxing out at 58,000 reports. In its 31st year alone, VAERS logged 18 times that number. Because of this disproportionality, the FDA's disproportionality analysis was washed out. Since both vaccines were of the same platform and same adverse events, the comparison was muted. This isn't a blind spot. The FDA was completely blind to adverse events, and the CDC wasn't even looking. There was a savior in the ranks of the FDA who correctly identified the problem, appropriately worked with the inventor of EB data mining to create a solution, communicated the fix to everyone who would listen. The problem is, no one listened. Luck was not on our side. The CDC failed to look. The FDA failed to fix a broken system that the CDC touted as the gold standard.
Oh my gosh, guys, the FDA failed? No way. Not the FDA. I mean, they're just so amazing and they're always right on about everything. How could the FDA fail? I'm obviously kidding. Some people in the chat have been writing like defund the federal government, but I just think we need to defund the FDA. We need to get rid of the FDA. I think that would solve a lot of issues if we just defunded and got rid of the FDA, in my opinion.
The HHS failed to protect us, especially after our freedom of choice was assaulted by the president threatening us all with, "Our patience is wearing thin." FOIA evasion was well practiced and discovered, obviously, not through a FOIA. Simply put, during the largest pharmaceutical rollout in human history, pharmacovigilance did not exist. That is the betrayal of our time, so vast that we cannot even count its casualties.
I just want to bring it to everyone's attention that nobody from the mainstream media reported on these hearings whatsoever. Radio silence. Don't you guys think that this is like important information that people should hear about? But a lot of people still trust the MSM and, rely on them to get their news. But the reality is you're not really getting news. You're just getting fed propaganda.
Thank you, Dr. Jablonski. Our final witness is Ms. Maria Young. Ms. Young will discuss her severe COVID-19 illness and how she spent more than 4 months in the hospital, most of that time in the intensive care unit. During her treatment at Johns Hopkins, she was placed on a ventilator and life support. And Ms. Young, welcome here, and I'm glad you're looking well.
Thank you. My name is Maria Young. Thank you to the committee members for inviting me to share my story today. Survivor, warrior, miracle. These are all words that have been used to describe me over the last 5 years. They aren't words I would have chosen for myself. For me, I was just trying to regain the life I had lost to COVID before we had vaccines or any possible treatments. In 2020, I went from being a healthy, active woman with a full career to being sedated, paralyzed, and placed on life support within days. I became a survivor of severe COVID-19, ARDS, acute respiratory distress syndrome, after spending 69 days on ECMO, extracorporeal membrane oxygenation, and 70 days on a ventilator. I am here because survival is not the end of the story. For those unfamiliar, ECMO is a rare form of life support, used when the lungs can no longer function on their own. Blood is removed from the body, oxygenated by a machine, and returned. It is invasive, complex, and used only when all other options have failed. ECMO does not heal the lungs. It buys hope and a little time. But that hope comes with significant risks: stroke, neurological injury, blood clots, infections, limb loss, organ failure, and of course, death. I spent more than 4 months in the hospital, most of it in the intensive care unit, ICU, most of it in a medically induced coma, and most of it alone. When I finally woke up, I had no memory of the time that had passed and no understanding of how much I had lost. During those months, my family lived through trauma that still echoes today. My mother was told repeatedly that I was not expected to survive. My sister wrote my eulogy. My family prepared themselves for the unimaginable, all without being able to see me in person. Day after day, my mother waited by the phone for a call from my doctor with the update for that day. They carried grief and hope at the same time, a burden that families of critically ill patients know all too well. While I was unconscious, my body endured a long list of complications that many ECMO survivors face. Multiple infections, including one that almost took my vision, blood clots, collapsed lungs, severe muscle wasting and deconditioning, delirium and hallucinations, prolonged sedation and sedation drug withdrawal, blood transfusions, a tracheostomy, a feeding tube, pressure wounds, a deep neck wound from cannulation, and long-term cognitive and physical impacts. These complications are not footnotes. They are the reality of surviving critical respiratory illness. They shape recovery for months and often years. They are especially hard when the diagnosis and treatment lack understanding and support. When I finally woke up, I had to relearn how to breathe, how to swallow, how to sit up, stand, and walk. I had to rebuild my life from the ground up. And while I'm deeply grateful to be alive, gratitude does not erase the trauma. Survival comes with weight, the weight of knowing how close I came to dying and that many others weren't as lucky. When I was discharged, my list of diagnoses included dysautonomia, cognitive impairment, demoralization, severe body deconditioning, long COVID, partial vocal cord paralysis, and post-intensive care syndrome, among others. But alongside that weight is profound gratitude. Gratitude for the nurses who spoke to me even when I was unconscious. Gratitude for the respiratory therapists who taught me how to breathe again. Gratitude for the physical and occupational therapists who celebrated every inch of progress. And gratitude for the doctors at Johns Hopkins who made bold decisions to save me, including placing me on my stomach while on ECMO to try to improve my lung function and oxygenation, something that had never been done before at Johns Hopkins on a patient on ECMO with a tracheostomy. They believed my life was worth fighting for. And gratitude for my community, who held my family up when they could no longer do it on their own. My experience led me to advocacy. Over the last several years, I've connected with hundreds of survivors, people living with long COVID, families who lost loved ones to COVID-19 or while on ECMO, and ECMO survivors who carry scars both visible and invisible. These communities are full of people who fought for their lives or for their loved ones' lives and emerged in a world that often moved on without them, many feeling abandoned by systems not built for long-term recovery, by insurance structures that don't recognize the complexity of post-ICU life, and by a public narrative that treats survival as the end of the story. My work is to make sure they are seen, heard, and supported. That's why I stay up to date on my COVID boosters and other vaccinations. I also continue advocacy with organizations like Vaccinate Your Family to share my story through them, through my personal connections, and encourage everyone to continue to get vaccinated against COVID-19 and other diseases in the hopes of helping people avoid the same traumatic experience I and my family went through or worse. Survival should not be followed by fear. It should be followed by support, protection, and the chance to rebuild a life with dignity. Thank you for your time.
Thank you for sharing your story, Ms. Young. I would love to connect you with Breanne Dressen. Many of the things you said are exact same words I've heard from the COVID injection injured. These people were healthy, they were active, now they're permanently disabled. When I first met them, held our first event in Milwaukee, all they wanted was to be seen, heard, and believed. That was their third. Seen, heard, and believed so they could get treatment. They still can't get treatment because they are not being acknowledged. I want to, once I introduce this video, I want to start my Q&A with a 1-minute video. But to set it up, this is a video of recordings of Zoom calls between the vaccine injured. And by the way, React 19, I think I read, they've got something like 40,000 active members. They probably would have more if Facebook hadn't been shutting down their support groups, leading to suicides among those, lack of that support. But this is actually a note in terms of what this video describes here from Breanne Dressen. She writes, beginning in March 2021, seriously COVID-19 vaccine-injured patients were flown to NIH, and this is March 2021, the same time they were made aware of the fact that they were going to mask the safety signals using the algorithm. Vaccine-injured patients were flown to NIH headquarters for extensive testing and evaluation and treatment. Study participants, and I think there are about 23 of them. Study participants received credible diagnoses, including, quote, post-vaccination neuropathy. Again, they were diagnosed as vaccine injured. And specialized treatments the participants say saved their lives. They were incredibly grateful that the NIH, people like Dr. Nath, were paying attention to them and treating them and improving their severe injuries. That same month, NIH researchers began promising participants that the study and their injuries would be made public. And apparently the email where that promise was made was also copied to Peter Marks and acting FDA Commissioner Janet Woodcock. The NIH then asked participants to remain quiet, say nothing, until they disclosed the study themselves. They complied. They feared if they were to go public, they'd lose the treatment, that all the thousands of other injured that were counting on them to be studied, to develop cures, wouldn't receive treatment either. So they stayed silent, holding on to the promise that help is coming for the many others nationwide. That study and the injuries were never disclosed to the public. They were lied to. And this video, again, read my report. Senator Bloom, I cannot believe you read my report based on your opening statement. Read my report. It is irrefutable. But the video is of Peter Marks, head of CBER, the man who was notified on March 1st, 2021, that the safety surveillance system that they were going to use to detect those rare and mild safety signals was invalid. It was going to mask those. It was going to hide those very safety signals. Again, 26 days later, a state-of-the-art system showed 25 safety signals, and I read how severe those adverse events were. But just listen to what Peter Marks, with the knowledge that he was treating vaccine-injured, and they weren't mild injuries. These were life-threatening injuries. These were total disability type of injuries. So he knew it. He was treating them. He knew that his safety surveillance system was masking these signals. They lied to them. Listen to what Peter Marks had to say. This is about a minute-long video.
There is incredible BS out there about like thousands of people dying, etc. That just ain't true.
No one's denying that adverse events can occur. That doesn't mean that any given individual might not have had something related to the vaccine. I'm not denying anything. The issue is that the number of cases have not risen to a number that leads to a clear differentiation that it's a signal. There's not a clear signal. It just says that we don't have a signal. We continue to query the various databases. The large databases still have not seen a signal.
You couldn't really tell. You just couldn't tell whether there was a signal or not. It's something that's been reported, but not as something that is clearly vaccine related.
You guys know we exist. We know that you know that we exist, but the public doesn't think that you guys know that we exist.
That was Brianne Dressen at the very end there. Again, they were pleading with the officials at the FDA, NIH, that knew they were severely injured by the vaccine, counting on them to make that public, to study their results so that others could get treated. To this day, they have not done that. Put up chart number 2 here. Dr. Wiseman. Again, I know you've looked into this in a great deal of depth. You know, probably the very complex mathematical models and algorithms of empirical Bayesian analysis. I'm not a statistician. I'm just a lowly accountant. How in the world could the people who were touting VAERS, Tom Shimabukuro in October of 2020, this is a system that can really detect even small safety signals. They had to hire the contractor that was putting VAERS, the VAERS reports into VAERS. They had to hire thousands of more people because of the overwhelming numbers of reports. Did you need a fancy statistical algorithm to tell you that something was going wrong here with these injections?
Yeah, clearly there's some big alarm bells that are going off there. But I do want to point out that, one of the criticisms of VAERS is that, that stimulated reporting and anyone can report and all that sort of thing. The point about these disproportionality analyses is that it actually removes that from the equation because of the way the mathematics are done. So obviously there's red flags in that sort of chart that you're showing there. But the key point about these disproportionality analyses, the Bayesian data mining, the PRR and others, is that it actually removes that from the equation because of the niceties of how the mathematics are done. So that's really important. So in the list of 49 events that you've listed there, these are all showing signals for the Bayesian data mining, and also not only that, in the PRR method, which is masked. They're showing signals. So whichever way you look at it, there's signals. And the key point, Senator, is that for the purposes of the EUA, the FDA will require to consider not only actual proven risks, but potential risks. And potential risks are represented by signals without necessarily having to prove causality. But in all the decisions, the law is very clear. It says that FDA has to consider actual and potential risks. And by hiding the potential risks in the various ways that you've described, the public were deprived of this knowledge, the doctors were deprived of the knowledge, the ACIP and the VRBAC committees were deprived of this knowledge. So every way you look at it, there's a problem.
So again, so my sophisticated mathematical model, when people push back on this, well, yeah, Senator, it's because we had billions of doses. So we calculated deaths per million doses, compared that to the flu. Again, that's disproportionate, right? Disproportionality. So flu averaged about 0.46 deaths per million. When we did the calculations, 25.5. That's pretty disproportionate to me. Throw
Right.
on, combine it with that. Again, you don't need, they didn't need.
Well,
And again, then they had the vaccine injured in front of them. They were treating them. They are diagnosing them, not with mild, but with life-threatening injuries. Dr. Jablonski, how do you answer that?
Several years ago, Dr. Brian Hooker and I did an analysis of VAERS when we tried to pinpoint when enough VAERS reports had existed to identify myocarditis. And that dates all the way back to the week of February 19th of 2021, which is well before even Israel contacts the CDC saying, we're seeing a whole lot of myocarditis. We want to speak with a relevant expert at CDC. It is way before anyone in the United States that the CDC admitted to them on May 28th.
Okay. They didn't start the clock.
All right, guys. Well, it's nearly midnight over here on the East Coast. I'm going to call it a night for now. We are going to pick this back up and finish it tomorrow. I would say probably between 8:30 tomorrow night. I'll be back finishing this hearing. Thank you guys so much for joining me tonight. It's always a pleasure. Thanks so much for everybody that participated in the chat. And I will see you guys live tomorrow night. Have a great night.